The most common cause of death in the world is heart disease. The death toll is increasing every year, and in 2019, heart disease accounted for 1 in 6 deaths in the world, which is estimated to be about 8.9 million deaths. Japan Medical Device, through research and development of the heart simulator based on supercomputer technology, provides unprecedented value for heart disease medical practice. We aim to improve the quality of life of mankind by saving as many lives of heart disease sufferers as possible. The reason why it is difficult to diagnose and treat heart disease in modern medicine is because the heart is a very complex, delicate, and highly individualized organ. Clinicians are required to appropriately assess the medical status of individual hearts, and then to specifically predict the future risks and treatment effects. However, today's medical science does not allow healthcare providers to obtain sufficient information for that purpose. To answer this problem, Japan Medical Device, with our heart simulator, is creating a new form of diagnosis and treatment selection for heart disease, and approaches the patient's present and future through our early detection and prediction technology. Heart Simulator is computer simulation technology that faithfully reproduces and visualizes the movement of the heart in detail in a virtual 3D heart model created from CT images, ultrasound images, and other medical information, such as blood pressure and electrocardiogram data. This research began in 2001 and achieved the goal with the help of supercomputer evolution. The University of Tokyo and Fujitsu jointly developed Japan's most promising and cutting-edge technology. We provide new value for all people involved in medical care. The virtually reproduced heart is very useful, not only for diagnosing current medical conditions, but also for predicting the effects of various treatments, and helps healthcare providers choose the best operative method. The dynamics of the heart, not accurately evaluable in the past, such as electrical excitatory propagation, the movement of each part of the heart, such as heart valves, and intracardiac blood flow, can now be visualized and quantified. A wealth of information brought by the heart simulator facilitates healthcare professionals' choice of the right treatment and opens a new phase of digital medical care that can contribute to improving the lifelong QOL of patients. How will the heart simulator change medical care in the future? Here are some specific cases to answer the question. Case 1. Prediction of CRT effects. The number of patients receiving cardiac resynchronization therapy by biventricular pacing is estimated to be more than 100,000 worldwide. However, about 30% of the treatments are considered to have poor efficacy, and with current medical technology, prediction of the outcome before surgery is difficult. The heart simulator can even reproduce electrocardiogram data and blood pressures of each patient, quantitatively displaying index values to clearly show the effects of cardiac resynchronization therapy by biventricular pacing. The technology predicting the effectiveness of cardiac resynchronization therapy by biventricular pacing with high accuracy results in less stressful cardiac exams for patients' bodies. Case 2. Congenital heart disease, operative method decision and prognostic prediction. The heart simulator is also promising for newborns with congenital heart disease, whose incidence is 1 in 100 births. The heart of a newborn is not only small, but also anatomically varies depending on their medical condition, and thus requires advanced surgical techniques for repair. Even veteran doctors sometimes have difficulty with determining the operative method. The heart simulator virtually reproduces the hearts of individual patients and even simulates the post-operative state. Therefore, surgeons can try various surgical methods in advance with the virtual hearts. This enables the prediction of the therapeutic effects, helps with treatment selection, and contributes to reducing patients' risks. Establishment of a new diagnostic method for adult heart disease. Early detection of the disease signs that lead to heart failure. In future medical care, the heart simulator will play an increasingly important role. We have received favorable comments from people in related fields. Congenital heart disease in children and babies is highly challenging due to a wide range of disease types. Moreover, due to the smallness of babies' hearts, repairing them is all the more highly challenging technically. The types of the heart disease vary considerably with each baby, and although pediatricians and pediatric heart surgeons team up to gather their wisdom, it is quite a challenge to address the disease. Therefore, if we can clearly see each baby's intracardiac blood flow beforehand using the heart simulator, pediatric heart surgeries will be safer and more reassuring. It will have very big benefits not only for patients, but for doctors too. Eventually, in the process of the babies growing up and becoming adults, the heart simulator, we believe, will play a very big role, and we have high expectations for it. We already have this wonderful technology in Japan that was created through industry-academia collaboration. Using the technology, you can reproduce each person's heart in a virtual space, and it will save patients who are struggling with heart disease. As Dr. Shiraishi mentioned earlier, clinicians, in particular in the areas of pediatrics and cardiology, say they want to use this technology as soon as possible. Now, the members of JMD, with a strong passion and a sense of speed, have built a system to commercialize this simulator. By solving common social issues of the world with Japanese technology, we want to be helpful to its people. We are looking forward to receiving your support. All we can do is make hearts visible, more vivid, and in more detail, just like seeing patients' real hearts at hand, what is actually there. And it is about being able to see the future. That may be all we can do. But we believe this will surely change the future of mankind. To ensure that as many lives as possible can be saved, Japan Medical Device will continue to pursue technology.
テクノロジーを追求し続けていきます。